Dr. Swali. How are you, sir?
Fine, sir. Thank you. Thank you for inviting me to be a part of this.
Yes, sir. Firstly, welcome to our show, The Pet Bet, where we discuss common myths and help people understand what are the misconceptions that usually pet parents would be having or questions that pet parents would be usually facing. तो वो सब एड्रेस के लिए करने के लिए हमने ये सर शो बनाया है. So thank you for being a part of this. You are one of the most reputed vets that I have come across, or we have come across as a team of Pawzeeble. So again, thank you for being a part of this. And sir, before we begin, as we always do, हम थोड़ा सा सर आपके बारे में, आपके एक्सपीरियंस के बारे में जानना चाहेंगे. So if you can just tell us a little history about you, it would be great.
Okay. Thank you. Thank you. And once again, Pawzeeble, thank you Pawzeeble for making me a part of this interview regarding dentistry for animals, or small animals. I would like to introduce myself. I am Dr. Hitesh Swali. I am from Bombay. I am having my own clinics at Juhu and Andheri, and also a parallel clinic at Thane. I come from a family of vets. My father is also a vet, practicing vet in Chembur. Sister is a practicing vet at Powai and Ghatpur, and nephew is also a vet from Powai. So for me, it's more of a family tradition, which is I've been following in the way to become a vet. And also, like, I have seen a lot of evolution of changes in veterinary practice and management, types of owners. पहले अलग जमाना था, people को शौक था, पैसे नहीं थे. आज with advent of time, people have money, people have time to spend also. We have got new resources for pathological diagnosis. In short, veterinary practice has leaped in tremendous way in the last 25 years. I am practicing since 28 years, and having a very good experience with small animals, and I mostly specialize in dogs and cats only.
सर, आपने जो कहा कि पहले का जमाना अलग था और आज का जमाना अलग है, so what are the differences that you have observed in the pet care industry, for especially for in terms of the pet parents, और थोड़ा आप veterinary practice के बारे में भी बता दीजिए.
So as I said कि मेरा पहले जब जमाने में ऐसा होता था कि खर्चे होते थे, पैथोलॉजिकल इक्विपमेंट्स नहीं हुआ करते थे, ब्लड टेस्टिंग मशीन्स कम हुआ करते थे, एंड विद अभी के टाइम पे देयर आर लॉट ऑफ वेटरिनरियंस हु हैव कम अप, फॉर स्पेशलिटी चालू हो गई है. देयर आर स्पेसिफिकली डॉक्टर्स लाइक ह्यूमन physicians have specific ophthalmologists, cardiologists, oncologists, neurologists. In veterinary also, like previously, as before 20 years, we used to do everything. We used to take care of the gynecology, we used to take care of the x-rays, we used to take care of the blood test. Now there are super specialty. Owners also want to have a very good diagnosis. With the advent of internet also, internet के ज़माने में people are, Google के ज़माने में people are also knowing what the treatment can be and what we can do. Spending power has increased tremendously. Gone are the days where कुत्ते को कुत्ता बोल के ट्रीटमेंट नहीं करते थे कि चलो अभी मरने वाला है, बुढ़ा हो गया तो कुछ मत करो. अब जमाना काफी चेंज हो गया है. Even at the last stage, people think and consider them as a part of the family, and they want to treat it the best. And now the spending power has really become good. Emotions, attachments have become much higher. I am not saying पहले attachment नहीं होते थे, पर ये होता था कि limited family members होते थे. अब फैमिली मेंबर्स के भी अटैचमेंट्स बढ़ गए हैं, एंड स्पेंडिंग कैपेसिटी होने की वजह से डायग्नोस्टिक टूल्स भी है हमारे पास, जो हम हेल्प कर सकते हैं पेशेंट को डायग्नोस करने में कि भाई आज उनको क्या डिजीज है, वेयर वी कैन हेल्प देम टू गेट द मैक्सिमम ट्रीटमेंट डन एट अ गुड फैसिलिटी एंड अ गुड कॉस्ट आल्सो.
दैट्स ग्रेट, बिकॉज हमने भी जब ये मार्केट एंटर किया था तब एक अवेयरनेस हमें पिछले 5 सालों में बहुत ग्रो होते हुए देखी है विद इन पेट पेरेंट्स एज वेल. सो इट्स अ वेरी पॉजिटिव साइन, एंड एज एन इंडस्ट्री टुगेदर वी आर ग्रोइंग रियली फास्ट. तो होपफुली अगले एक दशक में we'll be able to cope up with the rest of the world and bring in a huge difference when it comes to the entire industry globally. So on that note, sir, let us address the topic of the day, which is the importance of dental health for pets and how we are supposed to maintain it. So sir, on this topic, my first question to you would be, what are the some of the common dental health problems, and how can they be prevented?
As your first question itself is a big topic, I need to address it part by part. As you mentioned कि dental issue है, जैसे ह्यूमंस में भी आज हमें काफी डर लगता है डेंटिस्ट के पास जाके. साइकोलॉजिकली भी हमारा एक इशू है कि वी हैव टू गो एंड गो टू डेंटिस्ट एंड गेट इट ट्रीटेड. सेम वेटनरी में भी है, बिकॉज लॉट ऑफ ट्रीटमेंट्स इन्वॉल्व्स एनेस्थेसियास टू द पेशेंट्स, एंड वेयर द ओनर्स आर लिटिल बिट paranoid or little bit scared about giving anesthesias time and again. So early care like best hygiene methods, cleaning and proper advice from a veterinarian will definitely help to prevent the disease in the long run. And same like humans have root canals, periodontal diseases, gum infections, and wisdom tooth problems, molar teeth infections. These are all very common. And with the new generation treats, a lot of junk food which are being given to kids, specifically small breeds, the periodontal disease and dental disease are on the rise. And we, as I earlier mentioned, that we are also now having specialty for dental also. So a lot of veterinarians are doing special dental treatment also. So we will also help you for the dental hygiene lessons and basically training for how to take care of your teeth, of your pets.
Perfect. But sir, if you have to further dive in deep, so how can they be prevented? Like what actions should a particular pet parent take to avoid the dental problems firsthand?
So first and foremost is, as in human beings, also in animals, the teeth, deciduous teeth or the milk teeth, they are there and they fall off between 4 to 5 months of age. Many times the owners get panicky, pet parents get panicky, अरे मेरे dog के दांत गिर गए, there is something bleeding happening. Again, this is the first foremost I am telling you, because it's as a puppy, that is the first step where the veterinarian will be addressing that problem. So don't worry about the teeth falling at between 4 to 5 months or 6 months of age. There are sometimes deciduous teeth will remain in the oral cavity, which has to be physically tried at an early age to dislodge so that they don't create a problem in the future. There would be certain instances where the veterinarian will tell you, okay, we'll have to remove it at the early stage so that they don't create a gap or they don't create a hindrance in the later life of the dog. So it's better that we should do this. Now, dental cleaning actually doesn't require before 4 months of age, because the deciduous tooth or the milk tooth are definitely going to fall. So when they get a new set of teeth, they definitely require some cleaning. Nowadays, with a lot of products are there in the market where you can use it safely without any problems. I again request and tell all the pet parents, please do not use human toothpaste or human dant manjan to do that, because I've seen a lot of time people think we can use that and it's not a difference because both smell the same, both look the same. So it's no, there are a lot of differences. Fluorides and everything are not good for dogs. So please don't use human toothpaste on them. And also the Ayurvedic paste, we have not got any readings or any tests done on pets, the use of Ayurvedic toothpaste in dogs and cats. So please refrain from using them.
Okay.
And one of the most important thing is, a lot of times people ask us what the dental cleaning requires. As I mentioned, feeding of rawhide bones is a very good method of keeping the teeth clean. Mind you, rawhide bones are not bad for teeth. There are a lot of misconception about rawhide bones, saying that they are bad for teeth. If you use it in a proper way, means not cleaning the, people tend to wash the rawhide bones or keep them in the sun for drying, or they if it's dirty, they clean it and then they again gives that invites fungus to the rawhide bones, and then that can create a problem to the tooth. Normally,
what is a rawhide bone?
You get in the market, rawhide bones are typical bones which are available in the pet shops, which are meant for dental chewing. A puppy would enjoy chewing in that because he feels that urge of chewing it on the gums. So that's why how we get in human beings also we give teethers. Now in human beings we use a lot of artificial teethers, but in animals we cannot give them because of the fear of biting them off and gulping it down. So the rawhide bones are available in the pet shops and they are very good. And only thing you have to see that the size of the raw head bone is bigger than the size of the dog. People give small bones and then the patient gulps it down and creates a problem.
Sir, when it comes to the basics of dental care, then how many times should a pet parent be brushing their pet's teeth?
In a week, technically once is more than enough. As and when you tend to give a wash to the patient, that is more than enough. But in some states of India, we don't give a bath regularly. So in that case, once in 15 to 20 days, just a normal toothpaste and brush is enough for doing it.
Okay. And sir, what is the best technique? Because I have seen certain pet parents having a difficult time brushing their pet's teeth, because maybe it can be some kind of an anxiety that a pet has, maybe a newer experience where the pet resists brushing their teeth. So can you describe a few techniques?
Yeah. So foremost thing is that as you mentioned, it is fear created by the pet parent towards the patient itself. When from the early days only, we start, just putting the hand in the mouth of the dog on one fine day, one fine morning, and thinking that the dog will allow me to do everything. It's not like that. Initially, you have to start, allowing. There are a lot of dog pet paste available which can be consumed also. There is no harm if they consume it also. So sometimes you have to just get the patient get used to the taste of it. Lot of time it may not necessarily that what one pet likes the taste of the toothpaste, the other may not like it. So there are variations in that. So we need to keep them separate. Maybe you can try 2-3 brands. And also there are a lot of now soft brushes available which you can put it on your fingertips and just massage it on the gums of the pets. It works very well. And you need to make the patient accustomed to the procedure. You cannot expect him to just adjust to that. It's something like what you are combing. Like we don't expect, like a lot of pet parents say we comb once a week. It's not like that. You have to make the patient accustomed to the procedure. After all, they are animals. They should be adjusted and accommodated to the style of upbringing. So you need to upgrade that way and slowly introduce maybe you can do it for half a minute and then increase the duration of doing it. And also in human beings also 2 to 3 minutes is more than enough. You don't really technically require a lot of time for that.
Right. Perfect. So 2 to 3 minutes is an adequate amount of time to brush your pet's teeth, basically.
Yeah. Perfect. And also nowadays you get get a lot of liquids. You can put it in the feeding bowl, and they have certain materials which are basically cleansers. Now they may not do a 100% job, but they definitely do a good job. Okay, so you don't expect them to be something like what we have chewing gum and they expect us teeth to be clean. It is not like that, but definitely it helps to aid to fight the dental hygiene.
Got it.